Well, thank you very much, Judge, and thank you for your leadership. And I mean that very sincerely. Throughout this whole pandemic here in Harris County, you've been evidence-based, and you've been timely and accurate, and you've really guided the county, Harris County, through this pandemic in an extraordinary way. And I completely agree with your decision to go to Orange. It's absolutely warranted. And here's why. This Delta variant, I'd like to kind of structure my remarks first around the Delta variant itself, why we need to be concerned, then talk about where I think it will go in Harris County and in Houston. Next, talk a little bit about vaccines and how effective we expect them to be against the Delta variant, and then what we do about this very aggressive anti-vaccine disinformation in order to address that. So in terms of the Delta variant, this is far more transmissible than anything we've seen before. It's far more contagious. So if you remember, compared to the original lineage, the one from the United Kingdom, the B.1.1.7 variant, was 50% more transmissible than the original one. This one, Delta, is 50% more transmissible than that. And what it means basically, we're dealing with this Delta variant that's twice as contagious as the original COVID-19 virus, the SARS coronavirus type 2. And that's why we're seeing this very aggressive spread in areas where vaccination rates are low. So it really began in southern Missouri, went into Arkansas, Louisiana, and because these are the places where vaccination rates are lowest in the country, it's now it's spread east into northern Florida. Now it's going up the seaboard into the Carolinas. So it's making a big circle, which is going to knock off also Harris County and Houston as well, and then it's going to start to fill in. So we are looking and undoubtedly at a serious surge across the South this summer, which in some ways bears resemblance to what we saw last summer, with one important difference, I think. We've done a better job vaccinating older Americans, so the number of deaths will not be high. But unfortunately, we are going to see a lot of young adults, adolescents, and even kids get sick. And the big thing that worries me is, by now, anyone who's unvaccinated and has been lucky enough to escape COVID, your luck is about to run out. That's how transmissible this virus is. And so I think one of the messages for today is it's still not too late to get vaccinated. We are not doing very well here in Harris County as we could. We're doing better than other parts of the South, but compared to the Northeast, we're just not at that level. So let me give you an example. Up in the Northeast, in Vermont and Massachusetts, essentially all of the adults and all of the adolescents are vaccinated. What that means is it's likely that the Delta variant is not going to accelerate up in the Northeast because they were successful in getting everybody vaccinated, and that will slow or halt transmission. Unfortunately, in many parts of the South, like Louisiana, where only 15% of the adolescents are vaccinated, maybe 30-40% of the young adults, this thing is just going to sweep through states like Louisiana. In Harris County, we're doing better than Louisiana, but not by a lot. So we've got about 44 or 45% of the whole population vaccinated. That's not great. And particularly among BIPOC communities, it's even lower than that. So my big worry is that we're going to really see Delta accelerate throughout the unvaccinated component of Harris County. And to give you an example, is as the judge mentioned, essentially all of the individuals hospitalized right now in our Texas Medical Center are unvaccinated. Easily over 95%, maybe getting up to 99%. And 99% of the deaths are among the unvaccinated. So, to put it bluntly, in very stark terms, essentially anyone who's hospitalized for COVID right now, pediatric hospitalizations aside, adult hospitalizations, anybody who's hospitalized or is in an ICU from COVID right now is there by choice, is there because they didn't make the effort to get vaccinated. And that's what we need to fix. You might ask, why is Delta variant so different from the others? We don't really know. There's a preliminary study out of southern China that suggests that this virus is more efficient at replicating, especially in our upper airways, maybe 1,000-fold more virus. So I think people are shedding a lot more virus, and that has a lot to do with the basis of transmission. So knowing that, that makes wearing masks all the more important if you're unvaccinated and in any kind of indoor setting. You need to wear a mask if you're refusing to get vaccinated. But undoubtedly getting vaccinated is overwhelmingly the single best thing you can do for yourself and for your loved ones. And it's not too late. And remember, you don't have a lot of time, because if you get the 2-dose Moderna or Pfizer BioNTech vaccine, you need both doses to get a really robust immune response. So that means even if you get vaccinated today, you have to wait 3 to 4 weeks to get the second dose, and then you don't develop immunity till a week or two afterwards. And so it takes time. So now is the time to do it. There is no reason to wait. And, you know, we're hearing tragic stories now from ICU nurses who, right before their patient is going to require intubation for COVID, they say, okay, I'll get vaccinated. No, it doesn't work that way. You have to, this has to be a preventative. You have to be vaccinated now in order to prevent you from getting COVID. Let's switch gears a little bit, and I'm happy to answer questions about what it means to be vaccinated in terms of the Delta variant. There's some good news. A paper came out in the New England Journal of Medicine last night suggesting that if you get 2 doses of the Pfizer BioNTech vaccine, and it's likely going to be this hold up for the Moderna vaccine as well, because it's similar, they're both mRNA vaccines, the decline in efficacy against symptomatic illness is modest. So if you remember from the phase 3 trials, the 2 mRNA vaccines gave 95% protection against symptomatic illness. Now it's dropped to about 88%. So it's gone down a little bit, but still very robust. And in terms of serious illness and hospitalizations, it's close to 100%, or much better. So the good news is if you're vaccinated with those vaccines, you're unlikely to get sick. The questions I get asked a lot about, what about the single-dose J&J vaccine? We don't have those numbers. We have a small study done in the test tube suggesting the virus-neutralizing antibodies do go down compared to the original lineage, looking at the Delta variant. We don't really know what that means. That was true of the South African variant as well, and in terms of clinical correlation, it showed some decrease in effectiveness, but it was still pretty good. But what we're waiting for now is some guidance from the CDC and the FDA with the company whether they might recommend a second immunization at some point. Right now, but you should feel relatively comfortable if you've gotten a single dose of the J&J vaccine. There's a possibility you may need a second dose at some point. We've not gotten that guidance yet. A couple of other things. And this gets a little complicated, and I don't know how much in the weeds you want to go into, because the question I'm asked is, okay, I get it, doc, about the symptomatic illness. The vaccines are really good. What about asymptomatic transmission? If I'm vaccinated, do I know that I won't pass the virus on to anybody else if I do get it? And that we just don't have the full complement of data, partly because this Delta variant is so new. We know it replicates in much higher amounts. And so the questions, because the reason the CDC made the recommendation that if you're indoors and if you're vaccinated, you no longer need a mask, that was based on hard data from Israel and the UK showing that the vaccinations also halted asymptomatic transmission, around 90%. We don't know that with the Delta variant, and so we're waiting for that information as well. So until we have that information, given the fact that it replicates in higher amounts, what I'm doing now is, even though I'm vaccinated, I'm still wearing a mask indoors when I'm going indoors, like in this setting as well. I know I'm not going to get symptomatic illness because it's a good performer, but we don't know specifically about asymptomatic transmission. So it's kind of a subtle argument, and you may have a subtle discussion, and we may want to have some questions about that. so it can clarify it a little bit more. We have to be careful, though, because we don't want to send the message that these vaccines are not working. They are. These vaccines will save your life and will save the lives of your loved ones. They'll keep you out of the hospital, keep you out of the ICU. The other big concern I have is young people, especially from all the anti-vaccine aggression that's out there, are getting the message, the false message, that if you're young and healthy, you take care of yourself and go to the gym, don't worry about getting vaccinated. You don't need it. It's not true. We absolutely, it's great to take care of yourself and have a proper diet, but it's no substitute for virus neutralizing antibodies. So what we're seeing now are a lot of young adults, adolescents going into the hospital absolutely shocked that they're sick from COVID and may have to be intubated or may require an ICU admission, because that message they've gotten is that they won't get sick from COVID-19. It's absolutely not true, and that's why almost all of the people hospitalized right now in the Texas Medical Center are younger people, younger adults, and also pediatric ICU hospitalization, so in terms of adolescents. So it's really critically important. We also don't know all the details about what's called long COVID, which is long-term neurologic, cardiovascular, and pulmonary symptoms such as shortness of breath or heart palpitations, or what people call brain fog, where they're just not functioning at the level they want to, or having prolonged headaches or even depression. We're seeing that as well. We're starting to learn more about the basis of that, but we are seeing it about young adults. About 26% of young adults who get infected are getting long COVID. And this is not a time of your life when you want to get long COVID, right? This is a time in your life when you're applying to universities, taking your SATs, or looking for your first job, or maybe getting married, maybe starting a family. This is not the time you want to get long COVID. Yet another reason to get vaccinated. So unfortunately, the anti-vaccine misinformation, which is really disinformation, deliberate intent, is dominating the internet. So right now, if you do internet searches, or if you're listening to the media, especially the conservative media, what you're seeing is a lot of inaccurate information that's saying all the things that we're talking about, that saying falsely that if you're young and healthy, you don't need a vaccine, or somehow that the vaccines are dangerous or they're rushed when they aren't. We started working on coronavirus vaccines 10 years ago, and all of the COVID vaccines that we have today build on our research and development that we've done at Texas Children's Hospital and Baylor College of Medicine. So these vaccines have gone through as rigorous a process as any vaccine that we've ever released to the public, and I'm happy to answer more detailed questions about that. So I don't want to go on too long, but those are some of the big highlights, and happy to take further questions or however you'd like to proceed, Judge.
Thank you.